You introduced me, and I'm grateful for this introduction, as the pioneer in research of twins. This is not true. I come to the land of the pioneer of twin research, Mr. Aristotle, who has written that when you discuss twins, you should remember the legend or the mythology of Leda and the swan. If you don't remember this mythology, Leda was the wife of Tyndareus, king of Sparta. She was a very beautiful lady, and Zeus, the king of gods, liked her very much. However, she was faithful to her husband, but only at night. In the morning, she was given her virtues to Zeus, disguised as a swan. As a result of intercourse in the morning with Zeus and in the evening with her husband Tyndareus, there were two sets of twins, identical twins, two sets, but as you can see in this sketch, on the right side, this is my sketch, Helen and Pollux and Castor and Clytemnestra. Both of them are non-identical, of course, but the great Leonardo da Vinci, as you can see here, I'm sorry, where's the laser? Here, showed them going out of a single egg. So he was a great man, Leonardo, but doesn't know anything about zygosity. Didn't know anything about zygosity. But the idea of Aristotle was that if you see parents with twins, you should look at the eye of the woman. Probably she was unfaithful for her husband. And this idea, I jump about 1400 years further. This is Albertus Magnus, Albert the Great, and he was a scholar. He was not a doctor, he was a philosopher. He knew Latin, he knew Greek, and he could read all the literature of the ancient world. And he suggested, this is his grave that I visited in Köln, in Germany. He was a Dominican priest, and he suggested that those monstrous creatures of monozygotic twins are a result of the movement of the woman during sex. Because when the woman moves during sex, the sperm of the husband disperses in several chambers in the uterus. They believe that at that time that there are chambers in the uterus, and therefore there generates an awful two-headed monster. We don't believe it anymore, of course, but you can see here in 1547, this is a Flugblatt. Flugblatt means a paper. This was a paper written in 1547 showing a syncephalic baby, one head, two bodies. One is a male and another is a female. And how come? So they sent me this Flugblatt, and I had to write a paper about it in Twin Research in 2000 to explain how is it possible. These are some biological possibilities, but nonetheless, in order to understand what was the meaning of this Flugblatt, I had to translate with some professors in the Hebrew University that know Gothic, ancient Gothic, to translate this script. And it says that the woman was unfaithful to her husband, and therefore she got punishment from God. So the greatest idea until 1200 years was that twins are a punishment from God. God punishment. Indeed, if you think about monozygosity, there is one sperm getting into one egg, and instead of creating a single baby, it creates two babies. This is by all measures an embryonic accident. Here are the stages of embryo development. All the IVF people know it by heart. In fact, they know better their embryos than their patients because they're looking to see when to transfer them back and what to do with them. Let's look at some axioms related to MZ twinning. First, it has been proven worldwide that there is the same prevalence in different populations. If you see Chinese, Japanese, Korean, Australian, Indian, American, Israelis, Greek, the same frequency of MZ twins. Natural, I mean, natural. This is strange, but it is true. Second, as my previous the previous speaker showed you, there is the corner theory of MZ placentation, showing that if, or suggesting that if the split of the embryo occurs early, there is of the monozygotic twins, you will get a dichorionic placenta. If it is later, you will get a monochorionic diamniotic placenta, and if it's later, a monoamniotic placenta. Ladies and gentlemen, please read my lips. This is pure rubbish. Nothing is correct about that. There is no one proof of that. But it is a theory. It's nice to write it in every book. It is nice to see it in every textbook and to explain, because it's easy to understand, but it is not true. Even if you read Corner's original paper, you see that he was unable to present any data about the monoamniotic sets. And indeed, a few years ago, there was after I was talking about this incorrection and wrote something in several chapters, Herans showed that the timing of monozygotic twinning, you have to criticize the common model. And Gardner was supporting it, but there is a big debate now if the entire theory of Corner is correct. I give you two examples. One is the fission. Is it fusion or fission? Is the embryo splitting, or two cell lines are stuck together? We don't know. And if you see lizards, the same. And those, Ambroise Paré, the great surgeon of the French, showing this kind in conjoined twins. And indeed, Rowena Spencer said that it has nothing to show in conjoined twins. In her book, she autopsied 1,600 cases of conjoined twins. And she could show that there was no one case that was a fission, it was a separation. All conjoined twins was a result of fusion. Second example are the dizygotic monochorionic twins. The first really report that was in the literature comes from Souter, and it was in the New England. And New England does not publish case reports. But in that case, he published 5 pages of a case report showing what was the first proven case of dizygotic monochorionic twins. How come? So the idea is that there are 2 cell lines very near each other, and they are in the late morula, they are stuck together, producing a monochorionic twin gestation who are different. Another axiom is that we have a high malformation rate. The previous speaker showed that the risks. And there are some peculiar malformations in monozygotic twins. And also we have a very high risk of preterm deliveries, very low birth weight, and brain damaged children. Finally, there is proved today that all methods of assisted reproductive technology increase monozygotic splitting. All methods. And this came from papers like the one that we published from Portugal, and we shall see in a moment what are the proofs for that. What is the mechanism? The mechanism is unknown. One potential explanation is a familial tendency. And indeed, there are some families that have two series of MZ twins. I just reviewed a paper from an IVF center that has two successive monoamniotic twins in his center, in one patient. So there is probably a recurrency, but the recurrency is very rare. If you think that the delivery of monozygotic twins is 1 in 250 cases, so altogether we have 1 in 60,000 cases, deliveries, we have a family that has two MZ twins. And indeed, this is what we found. So it is mainly a chance event. However, there are clusters of MZ twins, especially in this village in India. You see there are 250 sets of twins in the same village, small village, and you see all of them in 2,000 families, 250 sets of MZ twins is a lot. And Bruno Riversade from Singapore, he's Italian, but he's now doing research in Singapore. He looks for the gene that causes the split in those Indian tribes, Indian villages, and he suggests that the elabella peptide hormone, I don't know even what it is one of the causes of degeneration of MZ twins. What we can do mechanically. We take an embryo, we split it with hair here, and put the two halves into two different mares, she horses, not in the same one. And then we generate MZ twins into two horses. We can look at the theory of the codominant axis. Usually the embryo at the very first stages has two codominant axes. One is disintegrating, as you can see in this sketch, and we have only one axis at the end. So we have one axis in our body. However, we see that. What's that? And this is the evolution of a codominant axis. The other axis does not disappear. And therefore, we have two axes and double. We see it also in chicks. And you can see that there is a double yolk sac in that egg. And we see it also in monoamniotic twins, that you have two yolk sacs in ultrasound. So seeing two yolk sacs in one embryo doesn't mean a malformation. It means maybe they are monoamniotic. Another very common theory is the blastoma herniation theory, which suggests that if you micro-manipulate the zona pellucida of the embryo, there will be a nick in the cover, in the egg shell, and the embryo will slowly go out of the shell, and it is a mechanically split. Therefore, you see more splits after blastoma stage and herniation after micromanipulation. The most common theory, or the most accepted theory, is the cell repulsion theory, which means that very early in the development of the embryo, the two cell lines have a different genetic status. And therefore, you see here two cell lines, and they repulse each other. They push each other away. So at the end, we have a monozygotic twins, but there are some differences. We see it also in very rare cases of an embryo that starts as a Klinefelter syndrome, and then it splits into a normal male and a Turner female. And we see such cases not very frequently, but we see them as we reported here in this series in the American Journal of Medical Genetics. What is sure is there is a trigger to cause zygotic splitting on one hand, and on the other hand, anomalies and fetal placental anomalies. What I would suggest to you, ladies and gentlemen, that infertility treatment, IVF, ovulation induction, whatever you do with infertility increases the chance of both zygotic splitting and anomalies. So if you look for the criteria of a teratogene, it fulfills 5 out of the 6 essential criteria as a teratogene. So infertility treatment produces a harm to the fetus. We have a lot of unanswered questions. This is a day 3 embryo. If we accept Corner's theory, you remember that I told you it is rubbish, where is the split? By day 3 there is a split for the dichorionic sets, 1/3. Where is the split? Nobody in the IVF world, millions of children delivered already, saw a split at day 3. Nobody. Where is the split? Why some zygotes split and the others do not split? This is a very old sonogram and a placenta of a triplet, a bichorionic triplet. You see 2 chorions, one with 2 embryos and one with a single embryo. Why one zygote split and the other did not split? Nobody knows. And here is the placenta of a monochorionic triplet. Monochorionic triplet. How do we explain monozygotic triplets? If the theory of repulsion is the most common, mostly accepted theory, how come that after one repulsion there is another repulsion? Impossible. So this is not logic. There is no explanation for monozygotic. How come that we have monozygotic quadruplets? How come that we have monozygotic quintuplets? And we have. These are the Iowa quintuplets with their doctor. They were commercially abused to publicize toothbrushes and toothpaste and etc. All 5 girls are quintuplets. What is our problem in understanding is there are only two models in mammalian species. Polyembryony, the splitting of an embryo, occurs only in 2 cases. In the human, Homo sapiens on the right side, and on the left side, the 9-banded armadillo. Only in those 2 mammals we have MZ splits. Here you see the armadillo with quadruplets, monozygotic quadruplets, and indeed this is the difference. We have mainly MZ twins, and the armadillo has quadruplets always. So based on those all problems, I produced a theory with my colleague, late colleague, Louis Kidd, and we published it many years ago, some 10 years ago, and now it has received full attention in the literature. See, when I wrote an editorial to the White Journal, at that time I had long hair. The first step in understanding is that the ovary, irrespective of race, contains oocytes with an inborn propensity to undergo splitting after fertilization. So the same number of potentially zygotic split oocytes are in Chinese, Greek, Israeli, American, any race has the same. Once you have a spontaneous pregnancy like here, you have a very low chance very low chance, 1 in 250, that actually this oocyte would be ovulated. However, if you increase the number of those oocytes that are given for fertilization, you increase the chance by ovulation induction, which is the common denominator of all assisted reproductive technologies. And these are data from myself in the New England Journal in 2003, and from the East Flanders prospective twin study showing that compared to spontaneous splits, assisted reproductive technologies 6 times more. Human menopausal gonadotropin, now we have other drugs, is 7-fold relative risk, and Clomid, the simplest thing, increases the chance by 12 times. So this first step of the theory explains why we have the similar prevalence of MZs in different races, and the prevalence increases after all methods of infertility treatment. Now let's go back to the armadillo. Always produces MZ twins. Always. There is no dizygotic twins. And in the armadillo, the split is binary. So 1 into 2, 2 into 4. And this is how in the armadillo produces MZs. Probably it could go on to 8, but there is no room, and then there is delivery. You see here the section in the uterus of the lady armadillo, and you see all 4 embryos in the same uterus. So the second part of the theory is the inborn propensity to undergo binary split. This is the only model that we have in nature. Why not in the woman the same? And this was actually suggested once by Robert Deron, that there is a split into 2. The 2 is a split into 4. And this is the only explanation. There is no other explanation how we explain MZ quadruplets. This is the only explanation how do we explain MZ triplets, that one of the triplets did not make it. Maybe this lady, this girl is sad because she doesn't have her twin. This is suggesting that we have 3 types of MZ twins. We have twins from the first split. We have twins that 2 of these are generated and 2 survive. And we might have one of this part and one of that part. So there are different MZs. And this is probably the explanation of mirror imaging. In some of the twins, 1/3 of the twins, we have mirror imaging. And this is a chapter in my book that shows that mirror imaging phenomenon in MZ twins, and you can see how similar the external features of women, of a patient or MZ patient, see them, and you can see how similar they are. This is a technique to put 2 slides, one on the other, and the non-shaded are the only differences. So what is shaded, what is dark, means that they are absolutely similar. Absolutely similar. Those are two images, one on the other. You see also pathology, BCC, basal cell carcinoma, and moles. You see it in the ear of the 2 ladies, monozygotic ladies. You see this in mirror imaging. And also moles on the hands. So this explains MZ twins, beautiful girls from Szczecin. And I would like to show you another idea going by Charles Boclage, who is really an avant-garde in twin research. And he is a geneticist. And he suggested that singletons, there are in this audience probably many singletons that had a twin in the intrauterine life. They had a twin, but they don't know. And Charles Boclage suggested that all left-handed persons are brain damaged. Like my wife, for instance, she is left-handed. And all left-handed people had a twin in utero, because this is mirror imaging. Who controls everything? The zona pellucida controls the timely hatching. And indeed, it is a very powerful membrane that can control the entire procedure. But where is the split? We looked at the split and we don't see a split. There is no physical split. This is the fourth part of the theory. Actually, there is no physical split. Suppose we look from above on this bunch of football players in the United States. From above, you would see a cluster of cells, a cluster of players. You don't see the difference because you can see from above the difference. But believe me, they are enemies. Once the referee would use the whistle, they will start fighting, started the play. And this is exactly what happens. We have a change that is probably caused by the zona pellucida that would disperse, the whistle blows on, and then everything goes and the split is seen. Indeed, we have one documented. This is a 5 days blastocyst that was forgotten in the Petri dish. Forgotten. They forgot to transfer. And after a few days later, they looked at the Petri dish. Oh, God, we forgot to transfer this embryo. And they saw that it was split. It is the only documentation of a late split. Otherwise, we cannot document the splits because it occurs in utero. We transfer the embryo in utero. You cannot see the split occurring. We have a lot to understand about monozygotic, the placental sharing, the anastomosis, and the Leah's asymmetric configuration where the umbilical cord is attached to the placenta. This is a lot of things that we need to do more. And this is why we are so keen about the place or the occurrence of the velamentous cord insertion in MZ twins, because it is so important in the health of those twins. And you can see here a placenta of MZ, or monochorionic, with 2 velamentous cord insertion from my clinic. And here you see another idea. How is it controlled in utero? Does the 2 poles of the embryo goes in parallel, goes one above the other, or in oblique? We don't know. So in summary, fertilization of a splitting-prone oocyte may lead to a zona pellucida controlled binary splitting, as we see in the armadillo, and produce quadruplets, triplets, and twin MZs. Thank you very much. This is the cover of my book, and we should write a new one.